Hello, everyone. Welcome back to Adventures Through the Mind, a podcast exploring topics relevant and related to psychedelic culture, medicine, and research. I am your host, as always, James W. Jesso. This episode explores ketamine therapy. Specifically, it explores somatic-based therapies assisted through low-dose ketamine with a particular focus on treating depression. Our guest is Pierre Bouchard. Pierre Bouchard is a licensed professional counselor doing somatic psychedelic therapy with ketamine. Before we get into this interview, though, I would like to give a big thanks to my patrons on Patreon, especially the people whose names are listed on the screen here on YouTube or in the description of this episode, wherever you are catching it. Those people give significantly to the financial integrity of the show, some of which for a long time. So thank you very much. If you are enjoying the show and you'd like to give back to the value you receive through economic or financial means, please become my patron on Patreon. It's a way in which you can sign up to sort of toss me a tip each month for producing podcast episodes for you and others to enjoy without an overhead cost to listen to them. So you can do that by heading to patreon.com/James W. Jesso or follow the links in the description below. If you'd like to express your gratitude for an episode with a one-time donation, you can do so through PayPal or a cryptocurrency of different varieties. Links to do that will be contained in the description to this as well. And with that said, big thanks to Juan for the very generous donation made during my 2-episode break. So this episode is going to explore Pierre Bouchard's perspectives on how low-dose ketamine in conjunction with somatic therapy can help to heal depression by healing developmental trauma. There's a lot of polyvagal talk, and if that is obscure to you, I encourage you to check out my interview with Deb Dana on life through a polyvagal lens to get a sense of what it is that we're talking about when we're talking about polyvagal theory. I'm going to link that in the description to this episode as well. So without much further ado, in fact, without any further ado, here is my interview with Pierre Bouchard on Adventures Through the Mind, episode 143. Enjoy. Okay. Pierre Bouchard, welcome to Adventures Through the Mind.
Thanks. It's good to be here.
So I got, I think, accidentally introduced to your work just by some happenstance recommendation or search on Instagram, which came up with, psychedelic somatic therapy or somatic psychedelic therapy. I'm not exactly, can't remember right offhand now exactly what order the phrasing is for you. And it was interesting because I had actually gotten a message from a friend of mine shortly after our prep call, being like, "Hey, do you know this person? I'm really excited about what they do. Do you know anything about this process?" I was like, "Well, actually, I just spoke with this person, and seems like he might be legit." So, I mean, all that to be said, that's a little bit of context. People who have been listening to the show are probably familiar with the term somatic or the concept of somatic therapy. We just had a relational somatic therapy or somatic relational therapy podcast about psychedelics not too long ago. But in order to sort of like lay the foundation for people who are maybe just stepping in for the first time, can you give us a sense of what somatic therapy is, in particular the somatic therapy you're trained in, and how it differs from conventional forms of therapy? Just leaving ketamine aside for a few minutes here, just focusing on that somatic therapy element.
Yeah, it's a really important question. And I'm excited for this to be entering the psychedelic space more. So when we think about somatic therapy versus traditional talk therapy, what we're doing is we're adding in the language of the body. Now we're in terms of body sensations and impulses as an entire other channel of data that we get to access, to harness for the healing process. Whereas, traditional talk therapy focuses on thoughts and feelings, which are fantastic. We're just adding in more. And I don't know about you, but I can convince myself of just about anything given enough time and the echo chamber of my own existence. Mm-hmm. For the body, there's a bit more objectivity for our experience. I don't mean we're objective in terms of sort of the larger larger reality, but in terms of what we're experiencing for ourselves, we identify with our emotions and our thoughts a lot more strongly than we do our sensations, our bodily sensations. And so they can give us a window in to what's really happening underneath the surface that we don't often have access to.
Okay, so a couple points of clarification there. When you say that it's more objective, what you mean in the sense is that how we relate to physical sensations has a little bit more detachment from our identity and whatever narratives we have about what things mean than our thoughts and our feelings. And when you respond to that, can you maybe sort of like isolate what you mean by feelings? Because when I think about feeling is a physical thing. So maybe you can answer those two questions simultaneously.
Yeah, it's great. There's a ton of great overlap here, but precisely. I would say just about our entire experience is an embodied experience. There's no way for it not to be. I think even if you think in your head quietly, just try to think. If you try and speed up the rate at which your mind is thinking, under normal circumstances, you can really only do that as fast as your lips and mouth will move. Even if you're not using them, right? So I would say everything has an embodied component here. But what we're talking about in terms of sensations is that there are sensations that are emotional in nature, and there are sensations that aren't. And this is where we get into the autonomic nervous system having a response to its environment in all moments. And we can use that information. And when I say information, I'm saying tightnesses. The language gets really non-standard. But oh, my chest feels heavy, or I notice a tightness in my stomach, or ooh, when we talk about that, my neck starts to get tight. These are all bits of information for us to access, right? And as you said, right, they're often devoid from our sense of identity, our sense of narrative in a different way. And so you might be able to say no, I'm totally good with this situation. I'm totally fine. Right. And if you start tuning into your body, just in this moment, what's it like to be you? As you're saying that, it's oh yeah, there's actually a lot of tightness. You notice my clavicles are tight, my shoulders are kind of rounding forward. It's aha. Well, great. Well, that's just more information for us to work with about what's actually going on in the picture here.
Mm-hmm. And so somatic therapy is therapy that includes an awareness or an attention to these more sort of like the physical sensations of your body's experience and response to thoughts and feelings, as well as your thoughts and feelings about whatever it is you're going through presently or as a response to the past?
Correct.
Mm-hmm. Yeah. So then where does the therapy part of this come in? Is it just what is, so that's the somatic basis, that's what somatic means, but what is this somatic therapy? And in particular, what is the somatic therapy that you're providing? Now, again, outside of ketamine still remainingly, yeah. What type of somatic therapy are you trained in, and how does it propose to have a therapeutic effect?
Yeah, so I'm trained in Hakomi, which is a style of somatic therapy. I'm also trained in a somatic trauma modality called trauma dynamics, which is a lineage that comes through from Peter Levine, and over the years have picked up sort of a smattering of other things. But where this gets therapeutic is that we're able to start using that extra channel of data in the therapeutic process, where as we're starting to access that information in sessions, it helps people deepen into what's happening for them, right? And so it might be something, someone's telling an emotional story, right? And we just sort of pause, like, let's just pause right here. And I want you just to bring your attention inward and just see what's happening inside as you do that, right? And there's a way in which when people learn how to stay with this channel of data, it starts to unfold, it starts to deepen. And there's a way in which by staying with it, they get to have more and more of it. They get to have a wider, deeper, richer experience of whatever's happening for them. And, by nature of how we operate, that's an ongoing and unfolding process. And so by staying with themselves in this way, something new will start to occur. Something, that process will keep unfolding. Maybe it starts as sadness and it moves into a form of grief. And from there, maybe it hits a wall. And I think in my mind, what's so lovely about somatic therapy in this way is this is where we start to get into sort of more of the underlying software of how people are organized, right? Like we're all very creatively organized around how to get love in this world. We all got our ticket punched one way or another, as one of my teachers likes to say. And we came up with these strategies for how to get along in the world. And what that meant is we do some things more than others, and we've limited our range in some way in terms of how we're allowed to express in the world. So for some, that might be, it's okay for me to be pissed off all the time, but it's not okay to be sad. And for some it's right versus it's completely the opposite. It's okay to be sad, but not okay to be pissed, or any variety of things. And so when we start to access somatic sensations, this becomes a place where we can start finding those edges that are outside of one's sense of a story and start to feel actually where in the body, where in one's moment to moment experience do they find those limitations. And by paying attention to that and bringing awareness to that process, we start to be able to bring some flexibility to it. And over time, expanding one's range of option for how they are in the world.
And so what might this look like in the context maybe of trauma treatment?
Mm-hmm. So what we've been talking about so far in terms of somatic work is the tuning into sensation as a useful aspect of a therapeutic process. The other part of somatic work that's really important here is tuning into impulse. So it's not just what's happening, it's what wants to happen. What's on the edge of awareness that might want to emerge a little bit more. And this is so important in trauma work, right? Because trauma is often, it's a thing that the experience happened so quickly that something didn't get to happen, right? And so there's a chance for the body to get to catch up, that even though this experience is long past, there's a way in which it gets to right what didn't go right the first time by getting a chance to complete something. And that's at least one way in which this shows up in trauma. There's certainly others. I had a client this last year who was doing a lot of work around sexual trespass. Someone in their life had been very sexually inappropriate. And in the actual event, they did what most people do in that situation is they dissociate. The body gets really still, which is a really intelligent way for the body to protect itself from a threat. Mm-hmm. Right? It's sort of, the play possum style of just, I'm actually going to not try and run away because running away is actually too dangerous. And my nervous system's too overwhelmed right now to actually activate that. So instead, I'm going to be really still. And this is, I'm talking about this and how human beings go through this, but this is true of all mammals. And so this is a deeply animal process. So when we were doing trauma work in this case with ketamine, but we wouldn't have to necessarily. In this case, what they got to do is they got to push this person away. They got to defend themselves, right? And that's the body getting to complete something that it didn't get to do before. And thus, by doing that, something gets healed. the body learns through that process that it can protect itself. There's a way in which by performing that action in the therapeutic setting, with the right kind of constraints, right? That something gets learned and integrated in the moment that starts to reorganize how a person and a person's psyche comes to think about themselves and what they're capable of around a trauma.
Okay, so then why don't you bring in now, since you just mentioned it, this might be a good opportunity to bring in where ketamine fits in this process, and what is it uniquely about ketamine, or specifically about ketamine, that helps to facilitate this process? Because from what I understand, somatic-based therapies, somatic trauma therapies tend to be, for most people, generally more effective than exclusively talk-based therapies. And there is an increased sort of recognition that bringing psychedelic substances on board in the appropriate ways within a therapeutic context can help dramatically increase the efficacy of those therapeutic practices. But what is it specifically about ketamine inside of the somatic therapy that you're talking about that leans towards it as being efficacious?
Yeah. Well, a couple of things here. One is that right now, ketamine is a substance that's legal, that we have access to. And so for this reason, it's a great medicine to start working with, because we can start right away. It'll be great when MDMA becomes legal, and that's another thing that we can use. But for now, we can use ketamine, and it is helpful. And how it's helpful, I would say, and so I'll make a distinction here that I think is really important. This isn't just about ketamine. This is about dosing. And this is a really important notion, because how we're dosing with ketamine, there's a lot of variance in the field. And what I'm talking about really suits one style of dosing and not another. And I personally like to see more of the kind of thing I'm doing out there. Mm-hmm. So what we're talking about is lower doses. This is lower doses of ketamine. These are not sort of the big intramuscular doses that a lot of clinics are doing, where people they're so blasted out that their brain gets this really wonderful reset. But in my mind, what that does is it basically uses the brute force of the chemical to create some sort of shift. That it does often reduce symptoms for people, particularly with depression. But the underlying wound doesn't get a chance to get worked with often. So the style of work that I'm describing is we're using a lower dose. People are definitely having a non-ordinary experience, I would say. They're in the medicine. They are having an interesting visual experience. Their body doesn't feel the way it would normally feel. And yet they're connected to themselves and the room and me enough that they can be sort of tracking what's going on for themselves, right? And in that space, because the ketamine has a bit of a sedating effect, and because it sort of can help people have a bit more of a bird's eye view of their situation, they're able to have their experience and also a little bit of a distance from it so that it's less overwhelming. And so from there, we can get into places where they may normally have been a little too overwhelmed to have gone to. And there's enough resource from the ketamine on board that they can really go through their experience in a very deep and meaningful way.
I'm thinking about MDMA and this idea. I think it was Ben Sessa described it as like a bulletproof vest or something. Like you can go into the trauma with this like bulletproof vest. I don't know if he used this next language, but like a bulletproof vest of like love and safety. And with that on, you can go into what otherwise feels absolutely unsafe as like a memory and as an experience. And that doing that sort of brings love and safety to those memories, but also brings you an opportunity to sort of remap the meaning that those events were integrated as having in your, perception of reality or perception of life, sense of identity and response to life, and then leaning into somatic, thus the sort of what is Stephen Porges say, the neuroceptive response to stimuli, the assessments of safety and danger can initially confused with the trauma can be sort of reorganized. So there's a clearer sense of what's dangerous is dangerous and what's safe is safe, and not the other way around. And that can come with the safety and love of, like, the safety of the love of the MDMA, even if it's difficult. And what you're suggesting here is that ketamine can have a similar effect afterwards, like sort of resulting effect. But instead of coming in with the love and safety, it comes in with this sort of like detachment in a way. Does that sound about right? Or maybe you can clarify that for me?
Yeah, I think there's some version of it. I mean, the intricacies of it are, it's very nuanced and I think complicated in terms of different people perceive it differently. But generally speaking, yeah, I think that there's a real truth to that. There's a way in which having a little distance can help people work through something. And when we're able to harness that in conjunction with somatic work, where people are able to then allow their nervous system to have a new experience of something, the result is that something really shifts in a big way. Like, I'm trying to think. So part of this is the somatics, and part of this is the distance, right? And so there's different times in which these things assist the work in different ways. But I had a guy in the office recently who recovering alcoholic who had looked at a lot of, had spent plenty of time looking at these alcoholic years, had spent plenty of time looking at the chaotic years of his early 20s. And under the ketamine was able to feel a degree of calm that his body had not really known. Maybe since childhood, maybe never. But it was actually the sedating quality of the ketamine that started to give him a new reference point for what it was actually could be to exist, because it was so much more calm. It was, it stood in great contrast to how normally tight and hyper aroused he was. And from there, his mind just naturally went to earlier years, teenage years, where he had to act out ridiculously to get anyone to pay attention to him and his chaotic family, and feeling just the rage of how unpaid attention to he was, right? And that was totally new territory. I mean, like, on some conceptual level, he knew about this, but to really feel into how deeply suffering he was as a teen and get a chance to start feeling this in the body in an undefended way really started to shift something for him. And so this is also where I'll transition, if it's okay, to sort of talking about why I think this works so well for people in terms of, there's something that's really important to understand about trauma and depression. And by no means is what I'm about to say some grand theory about what all depression is. Depression is such a massive category that we're used as sort of a catch-all to describe so many things. But at least there's a subset of depressions that I see in my office that I think relates to this. And so what I'm speaking about particularly is people that have been depressed since childhood. I'll regularly have people come in the office say, yep, I've been depressed since grade school. I've tried everything. Nothing really works. Or I've had some success. I've been on 6 different SSRIs. They work for a little while and then they don't. I've done EMDR, blah, blah, blah. I've done everything. Nothing really shifts it. And so there's an important piece about trauma to bring in here. So, to say, anytime I hear someone say they've been depressed since childhood, I'm immediately something registers to me that says, let's start looking for a developmental trauma. So make a distinction here between more event-based trauma of, say, like a terrible thing that happened, So that's a thing that happened that shouldn't have. You think an accident, an assault, a sexual trespass, any of these kind of things. It's a bad thing that shouldn't have happened that did. Whereas in developmental trauma, one way we can talk about this often is it's the good thing that didn't happen, right? It's a child being paid attention to in a loving way. It's adults being curious about them. It's parents and loved ones reflecting back to them their emotional state. When this doesn't happen, this is a form of a trauma that happens for people. And certainly, being just pounded on constantly, emotionally speaking, as a child, this is also what happens in developmental trauma. Of like, there's just no escape. My home is chaos. That's also developmental trauma, but that it has a different flavor. So what we're talking about is the things that didn't get to happen that should have, right? It's like an underwatered plant over a long period of time. And so oftentimes this can be a big origin for how a depression forms for people. When in the absence of receiving this really critical nourishment as a child's nervous system, in order to deal with that lack of love, will turn down its sense of need and go numb, right? And so if we're talking from a polyvagal perspective, right, the nervous system learns if I go into a dorsal vagal place where I just don't feel so much, there's a numbing quality, it's actually easier. Mm-hmm. The problem with this is that that gets really habituated, and it moves from being a state people spend time in to a trait they live in. This is just a trait of their personality, as Deb Dana likes to say. And so the ketamine work becomes a place where we can start to access those early wounds where that got created in the first place, install some new nourishment, and then help them learn some new options for how to be in the world to actually have some satisfying connection that they're so deeply in need of.
I'm sorry, maybe I parsed out, but where is what's missing coming from in this session? Like you have like the detachment from, you're able to detach, dissociate in a constructive way with the ketamine because you're dissociated in a way that makes it safe to feel what you've otherwise been dissociated from, right?
Yeah.
It's maybe like functional dissociation or something. I don't know. I'm just making that turn up right now. But, and so you can feel into that thing. Oh, okay. So that's what's sort of happening. But where is the good stuff that wasn't gotten coming from there? Is it coming from anywhere? Is that important? And if it isn't, if it is important, where's it coming from?
Yeah, it's a really important question. Thank you for asking that. Mm-hmm. Where it's coming from is two pieces. One of it is getting to feel that what was too much to feel at the time, to feel the utter heartbreak of being alone, right? And in my mind, one of the critical components of what we're talking about, at least this form of depression, starting in childhood, is actually how deeply alone children learn to feel, right? When they're not matched, when they're not feeling seen, when they're not being reflected to as valuable, or the many ways that this happens, the experience is one of being deeply alone. And you got to remember, like, what we're talking about is just a mammal's nervous system. This would be no different for a chimpanzee or any other mammal. But like, let's take a chimp, for example. If you're a baby chimp or a young chimp and you're alone, it's a bad situation. It's a real bad situation. You are dependent on the troop protecting you. That is, you are rife to be eaten by a predator, right? And the thing is, for trauma and how we're understanding it here and how it shows up in the nervous system is there's really no distinction between perceived threat and actual threat. And so for a child to feel deeply alone on some level is profoundly threatening to the nervous system. I'm not saying they experience that as such in the moment. It would actually be too much to experience in an ongoing way. And so the body learns to numb itself to that experience. So to answer your question, part of what comes online here for people is to start feeling what was too much to feel then, to feel the grief and the bitter tears of how alone they felt as a child. Right? So that, and for that to just start to move and get metabolized, and this is just something that seems true of somatic therapy, generally speaking, which is that if we're able to bring mindful attention to something, it starts to metabolize. It starts to move. It's the sheer act of having a chance to witness it and hold it as a grown-up who's I'm aware that I feel like a 4-year-old who's alone. There's a witness capacity here that by doing that, there's a different the brain regions are working in a different way around that memory than they were at the time. And so that memory is able to get consolidated and stamped, so to speak, so that it's not existing as a traumatic memory. The other place where this shows up, or the other way that this gets healed, is actually through the relationship with the therapist, and getting a chance to experience the nourishment of another. And if it's okay, I'll tell you a little story about what this looks like.
Yeah.
So I had a guy in my office who was working with me around depression, and in particular, this kind of particular depression, been depressed since grade school. And we're in a session, and he's in the ketamine, and he starts noticing some tightness in his abdomen. It's like, great, follow that. Let's go into that. And as he does, his body starts to curl up more and more. And as it's curling, I'm just having him try and notice, just having a memory of feeling this way. Does this relate to anything? And just remember an emotional memory of this as a kid, of just I'm curling into a little shell because you felt really alone. We're able to put this together over time, And so he's starting to feel really alone and feel kind of like this tight shell. And as he's doing that with the distance of the ketamine, he's starting to get this sense oh, I was hard to give to as a kid because I was protecting myself. So even when support was offered, I was actually already protected against it. And he starts to make these linkages. Oh, this is what I do in relationships. I more than anything, I want the women I date to comfort me. But when they do, I'm actually not able to start to receive it. And so this is starting to map. This is starting to get on the board for him, right? And it came from starting to follow this impulse, this involuntary impulse that he's able to allow himself to get out of the way of through this curling. And as he starts to do that, something starts to soften. It starts to open. There's something around noticing this that allows something else to happen. And I asked him something in that moment, yeah. And as this is happening, just let your radar pick up that I'm here with you as well. Can you feel me in this space? And he pauses for a moment and he's quiet and he nods yeah, I can feel you here. Right? And so what we're doing is we're harnessing sort of the interpersonal nature of the work. We can just bring that in as the object of what we're paying attention to. And it's nice. So I asked him yeah, and what do you imagine I feel toward you? We're harnessing his mind here. He says yeah, he says something yeah, I feel like you're on my side. Yeah, right. I'm here with you. You're going through this. And like, yeah, I am on your side. Right. So we're creating this ventral vagal. He's tagging for significance that there's something ventral vagal online, that there is support in the room here. Right. And, I ask him something like, right. And see in your body in this moment, is there anything that wants to happen? And as he does, his arms, which had been kind of curled up and were still sort of tight, one of his hand closest to me, because he's laying on a couch, I'm sitting in a chair nearby, his hand starts to unfurl and it slowly reaches toward me. And I just coach him to just move slow and to notice all the little sensations that are on board with reaching toward me. And eventually he reaches far enough and we start holding hands. And as he does, he nods and a tear comes down and his body fully relaxes. And so we went from, I'm a tight, protected child who doesn't know how to get nourishment, to having an experience in the present moment of what it is to open to nourishment, interpersonal nourishment. So this starts to put something on the board of his mind, right? So now he has an experiential reference point for what it is to get some of this. And this is something that we, over a period of sessions, can build on so that it becomes an option that he can access in his life.
Mm-hmm. So building on over the course of a few sessions sort of brings in a curiosity that I've been holding over the course of this, which is, of course, single trial learning is real and it happens, but generally when it comes to having these really nourishing sort of revelatory moments, this person has this moment of like connecting with the thing, following it until it changes, and then having this moment of like something brand new and different presently, which is also what was lacking in the past, while simultaneously experiencing it in the present and the past, infusing it all together. And on the other side of it has this sort of like different platform to stand in, or this different place to stand in as the elements that otherwise would be expressive of the initial trauma manifest in their life, and thus they have maybe a different way to respond to it. But this person has, I'm just assuming, whatever, we'll say 30 years of this one way, and
right.
Like maybe an hour of this other way. It's there now, but, and I just thought about, like, I got bottlenecked with questions about neuroplasticity and glutamatergic activity and long-term potentiation, but we'll just set that aside. But he has this 1 hour of this. Like, how then is that cultivated so that it is increasingly a platform from which this person is now able to show up to the rest of life? Because yes, depression is a consequence of this developmental trauma, okay, based on your proposal here, but it's not that the depressive behaviors over the course of a few decades doesn't result in a living lifestyle and living environment that is a direct extension of, consequence of, and feedback supportive or feedback sort of contributor to, right? So
yeah.
So what does it look like? What does this sort of like working with it afterwards look like in order to start reshaping the person? Because obviously, I guess it's a question about integration, obviously. So I'll just step back now and let you take it from here. Yeah.
Yeah. No, you've laid it out gorgeously, and it's really important. And what you're pointing to, right, is that you're absolutely right. It's not about having one sort of cathartic, sexy experience where they then somehow stick the landing and their life is better. This is where, I take such issue with actually how psychedelics get talked about most of the time, because it gets framed in this way of like, oh, we're just going to shake up the snow globe and unwire patterns, and then all of a sudden things are going to work well. Like, yeah, maybe some of the time. But what we're describing here, right, is so ingrained. And that this is where I think I would make a strong case for ongoing work with someone. This is way outside of what we're talking about for some 6-session package that I think a lot of clinics offer. It's going to take more than that. This is where we're talking about doing work, and each experience is iterative, right? There's an unfolding and there's an integration, and then some of that gets online, and then they go back the next time into another ketamine journey, and something else gets to build on that. And over a period of months, there's a neural mapping that gets to build out and get more robust over time because we're chaining numerous experiences together, right? And so a way that I work is we do a ketamine session 1 week and an integration session. Ketamine session, integration. For some people, it's more. For some people, it's less. But the point is that this has to be an ongoing experience for people for a period of time for this to really get online. And part of what we're talking about here is also a really important part of trauma work that I don't think gets spoken about enough. Trauma work typically gets framed as we're going to help someone's nervous system move out the bad thing. And that's really important, right? Like we're moving out the pain, we're moving out getting a chance to defend, we're getting a chance to feel supported. All of this is good. But what we're not talking about is what are we moving toward, right? Like what is actually a life where there is support, where someone is held in a limbic field of support, which is, I would say, our birthright as human beings. As I like to say, we're basically apes wearing cotton. We're built to be in connection with one another. And so this is where the work looks like learning what it is just to receive support. It looks like also learning what it is to be with oneself in a really close and loving way. Oftentimes, folks with depression, they live in their psyches. The depression becomes like an autoimmune disorder where they're constantly attacking themselves. They're constantly, offering themselves negative assessments of themselves and being just dumped on with shame. And so part of this is, I'll step back for a sec and say, the way we're developed, the way we grow, is we have to receive it from the outside first before we can give it to ourselves. So my job as a ketamine therapist is to be, in part, the loving figure that can help someone get this reference point from outside. Once that's a reference for them, they can start to learn how to give that to themselves in a big way. And that's where there's like a logarithmic curve of resiliency that happens over time, where my job is always to put myself out of a job, and for this to start coming online in such a deep way that they're able to continue to support and heal themselves. And all of a sudden, all of the help that is around them in their life starts to tune in significantly. They start to notice that it's available and can start to reach out for it and shift how they are shift their lifestyle, shift how they're behaving in their lives. So instead of withdrawing in a moment of stress, I'm actually going to reach out, right? These are sort of the long-term shifts that really contribute to not just reducing the symptoms of a depression, but uprooting a depression.
Let's shift gears a little bit because, and maybe there's some back reference, because earlier you said, one of the reasons why working with ketamine is good is because it's legal now, right? And yes, and also that is sort of fraught as well, because it being legal and you being able to work with it means that people are working with it, and not all these people are perhaps as qualified and certainly don't necessarily have protocols that are explicitly helpful, especially as, a good sort of portion or sort of let's say like a predominant paradigm from what I understand looking at it from the outside, a predominant paradigm in ketamine therapy for depression is bringing the person in, like you said, and giving them the ketamine. They feel better. They feel better possibly from an experiential standpoint, but we look at it, we see the pharmacodynamics produces changes in the brain. Those changes in the brain result in dramatic and acute reductions in depression, suicidality, right? They have that. They're good. 7 to 10 days, longer apparently if you have alcoholism in your family. I'm pretty sure there's a genetic predisposition that makes the ketamine reduction in depression and such last longer. But nonetheless, it's like you come in, you get your boost, and then you roll out, and then you come back when you need your boost again. And you may or may not be getting a whole lot of what you're talking about here. I mean, mind you, as a person who has had a full peak psychedelic experience on ketamine, there's not a whole lot of like talking with the other person there when you're in it. So there's not a whole lot of what you're talking about here. It's more sort of like a come in and walk away kind of thing, or even the lozenges where you give it to people and they take it at home and they just sit down for a little while. So, I mean, I feel like I just expressed my thoughts there, but I'm curious on your thoughts on this issue, and where you see that perhaps is a benefit, because obviously some people, they benefit from that and awesome, but where you think that sort of, that might be problematic.
Yeah. Well, I mean, I want to be a little careful here and say I have really strong opinions about, I like doing the kind of work I like doing, and I think it helps people in a really good way. By no means do I think this is the only way to utilize ketamine. Not everyone wants to do deep psychotherapy. And I might disagree with that personally. It's like, well, I think you're better spent doing that. But that's every person's choice to make. And if going to a ketamine clinic every 2 to 4 weeks to get a boost, to sort of maintain a cruising altitude, keeps them off of an SSRI dependence and helps them maintain a quality of life that they're happy with. And I think people should feel free to conduct themselves in that manner. I think for me, why this issue matters so much is that I think looking at the field of psychedelic-assisted psychotherapy, to me, being able to weave in somatic work with a deep understanding of interpersonal neurobiology and attachment, I think we can I think we can really raise the standard of practice that is common here. And, it's a lot of training. It's a lot of training to develop these things, but I think it's really within our reach to do this. And so I feel a strongly vested interest in seeing more people know at least that this is an option to them, that there's ways of utilizing ketamine outside of providing a safe container and a supportive sounding board once they come back from a ketamine experience. For some, and by no means am I saying this, I'm not saying this is the only way. And certainly I have seen people, especially in a serious suicidal state, really benefit from, a couple of IM doses and like three sessions a week for 2 weeks, really get catapulted out of a suicidal depression, where all of a sudden that leveraged their neurochemistry so well that they're able to start working again on things that they couldn't before. That's fantastic. I'm so for that. Yeah. And so and this, I would say, and more of this, I think would be good.
So, one sort of like, I was going to minimize myself by saying pet peeves, but I would say sort of professional opposition or professional criticism I have of something that's happening in the ketamine field, from what I can understand, is this premise that in providing the type of therapy you were just talking about, the sort of larger dose it isn't really therapy. It's more ketamine administration in a safe context. And then, so clinical administration of ketamine for the positive benefits that naturally come over from a ketamine session, is that the training that goes into this sometimes is no more than a weekend for people who have never taken a psychedelic before in their life. They've never even taken ketamine at the doses that they're giving it. Maybe they do, maybe they don't, but it's not required. And due to what I think might be a wrong, patently wrong perspective in the medical field, which is, you lose your objectivity if you try the drug that you're giving to people, is that these people end up getting, or these facilitators or administrators get little to no training, and they're giving people experiences that are like, we're talking about at low dose. Okay. It sounds really coherent to understand what you're talking about here. And yet at high doses, it is some of the most mind-blowingly obscure and strange, transdimensional, infinite, non-locality, zero, no longer independent individual points of reference, timeless. It's just incredible. And yet people are given these experiences, they come out and they're like, good job. You look good to drive. I'll see you in a couple of weeks. Right. And so I'm curious, how do you feel about my criticisms of that? Do you think that's fair? Is there something else that you want to speak to on that, or places that you feel like you'd like to push back on me?
No, I also share a professional opposition to this style of work. I think what I see now, the big doses that you're talking about are really big doses. I liken it to sort of consciousness origami. It's such an odd way of being bent and melted, and it's a hell of a thing. And I think clinicians should really know what that's like to be on the receiving end of it. My sense is that clinicians should really know what it's like to be through it at any dose. And it concerns me that many trainings are a long weekend. People have maybe an experience or two. I do see that people have a lozenge experience, they have an IM experience, but then they get a certificate and they're a printed, certified ketamine person. And I do feel concerned. I do feel concerned with that. I think it's a good start. I also think holding space while someone goes into something, and not being too interventional, to me, there's sort of like, I think the really beautiful and sane impulse behind that as a clinical model is that it's a do no harm model. I think we see the same thing in terms of what is offered through MAPS for their training for MDMA. I've done parts A and B of that training. We're trying to not get ahead of the medicine. We're trying to let the person's experience lead, and so that you don't get so precious about what you do that you're actually bending them outside of their own experience. And I think that's a really important baseline that we need to set as psychedelic therapists. So from that perspective, I think it's a wonderful start for people to learn how to hold space in a beautiful way, which really requires a therapist to be with themselves and be with their own discomfort.
Their own need to be important, even, I know that's a thing for therapists as well, is like the need to really get in there and know like you're helping that person, right?
Right. Absolutely. I'm the therapist and we're going to talk about this and it's going to be really meaningful. Right. So for all of those reasons, I think it's really good. What I would like to see and what I offer in my own practice, and this is how I was trained as well, is an apprenticeship. So when I supervise people, what I have them do is they have them come do a series of sessions with me over time, often 10. And so they'll do 10 ketamine sessions where they're just receiving. They're just the patient and I'm the therapist, and they just get to be in the medicine a number of times and see how all the ways it can look for them, and get to go through a bit of a process. To me, it's sort of extending the idea of what it is to be a therapist generally. Like I would never refer someone to a therapist who's never been in therapy before. Why would I think a psychedelic therapist who's not deeply familiar with the territory of that particular medicine would be any different? And with that in mind, I think this is where, we come up against legal challenges to this. And I hope we can find a good, flexible way moving forward that not only is an apprenticeship a good idea, but I think an ongoing relationship with the medicine is a good idea. I feel very fortunate that in Boulder, Colorado, in the Boulder, Denver area, there's a number of ketamine therapists now. And we can trade sessions. We can trade sessions with each other, having our own prescriptions. And I think that's a refinement of your own consciousness, a refinement of your own process, which is deeply important, as a psychedelic therapist, I would say. But then, and just getting to have a regular relationship to the medicine.
So, it's not, from what I understand, it's not particularly easy to find people doing what you're doing. Okay. I mean, like I don't have you on the show as like an explicit recommendation to people to come see you. I have you on the show because I think your thinking is clear. I've never worked with you, and if other people think your thinking is clear, they can follow up with you and make their own assessments. Right. Yeah. I don't not recommend you, but what I'm saying is that there's also, so other than maybe going to see you in Colorado, there isn't really maybe a lot of people doing the kind of ketamine work that you're talking about here. Maybe there is, they're just not really like on the board, or they're hard to find. And yet it is rather, like increasingly easier, or at least increasingly more accessible for people to find something a little bit more towards the sort of like the type of just going in, getting your whatever, or getting the lozenge, whatever, and doing it at home while sitting in a nice chair, which, I mean, personally, I like to give it a try, but anyways, so that being said, knowing that the type of intervention type work in the session and the type of integration therapy that comes afterwards, like how it's all packaged together that you offer, is not really available in a lot of places elsewhere. Are there suggestions you might have for people who are getting this other sort of style of therapy in order to sort of work with it in a way that is advantageous to them without having access to that type of facilitation? There might be another question that comes after that, but that's the one right now.
It's a really good question, and I wish I had a tidy answer for it. I don't know that I do. Oh, let me pause for a sec. I think what occurs to me here is that, I mean, one, the psychedelic therapy space is unfolding so rapidly, and so it really remains to be seen what's available. MAPS is just doing its damnedest to scale, to offer this as quickly as possible. There are ketamine trainings rolling out constantly. None that I know of that are really speaking of the kind of work I'm describing, but they're happening. With that in mind, I think what's nice about sort of the baseline training, like we were talking earlier, is that level of, look, hold some space and let some process happen. That's a foundation upon which to build. And I think for therapists who are interested in somatic work and are trained in somatic work, you can tinker and you can start finding your way into working with ketamine in this way. And so my call would be for somatic therapists to get curious about working with ketamine, get some training, and I'm hoping to be opening a clinic in within the year and offering training around this. But yeah, it's a bit hodgepodge right now. I would also say to those clients who are maybe interested in this kind of work that to whatever degree they are available in your area, you might seek out a somatic therapist, even if you're not seeing them during your ketamine sessions. You may learn something about yourself by sheerly being opened in the way that ketamine opens you that you can then pull into, air quotes, normal somatic session and really benefit from it.
Let me just, speaking of taking a second, let me see if there was another question here. No, there isn't. But because I thought maybe I had another question from before, I just wanted to make sure there was a space. I do have one question, which is sort of like a question that only you could answer, which is there something in the conversation today that wasn't said that you feel is relevant to speak on before we sort of like do a closing? Something that you feel like is bubbling up and deserves to be held in the container of this interview so far?
Well, I'm sure I'll think of it 20 minutes after we close, but
yeah.
Let me see if something wants to come through here. Yeah. There's maybe just sort of a little bit of an encapsulation I'd like to offer here, which is that, to my sense, the quickest way to learn anything is to have an experience. When you can start chaining experiences together, that can start to grow out a new neural network. Given enough time and participation, people are able to develop totally new habits and new patterns that are more life-affirming. And in that, patience, I love I forget who said it, right? It's like, it's never too late to have a good childhood. And this is where this realm of psychotherapy really shines, and I think can offer a lot. And that what can happen, the missing experience that gets to happen in the therapeutic office with loving attention can really shift things for people in a pretty dramatic way.
Great. Thank you for that. How about we end off here with the links and relevant handles for people to follow what you do or get in contact with you?
Love it. Right now, I would say the best way to get a hold of me is on Instagram. It's Pierre Bouchard, LPC. And unfortunately, I'm not taking new clients right now. So, but I'm happy to have conversations with people, and that's where you can follow my work.
Great. Please go ahead. Was there more? No?
No, that's good. I have a Facebook page, but it's not well tended to.
Great. So Instagram. Great. And I mean, I would encourage people to reach out nonetheless. You said you're not accepting clients now, but who knows, by the time this interview comes out, things might change. So timeframes might. Go ahead.
Absolutely. No, and please get on my mailing list. When the clinic opens, we'll have a lot of space for new people, and we'll be doing this kind of work.
Great. Okay. So Pierre Bouchard, thank you so much for being on Adventures Through the Mind today and engaging this conversation for all of us, and for bringing this frame to ketamine therapy, which from my perspective, for whatever it's worth, being just a random guy on the internet with a podcast and a couple of books, seems like a good direction to be encouraging. So thank you.
Well, it's been a pleasure. Thank you.
And cut. Okay, thank you for tuning into this episode of Adventures Through the Mind. If you liked it, please share it directly with a friend or publicly out into the hive mind of your social media. You can also express your gratitude, the value you received for this listening to this episode by doing a donation through PayPal or through a cryptocurrency, or by becoming my patron on Patreon, where you can pledge a certain amount to be given to me each month, starting with as little as less than a cup of coffee a month, all of which contributes into the sort of foundation of financial integrity that allows me to invest full time into producing the show without any overhead costs and without any expectations for me to alter the content to make it more commercially friendly. So the links to do all of that are contained in the description to this episode, wherever you're checking it out, or on YouTube. And thanks so much. I'll see you on the next episode of Adventures Through the Mind. And until then, take care.